For Action News, I'm Anna Samovska. A recent analysis of the new proposed cholesterol guidelines could mean statins are in the future for many adults over 40. About 25.2 million people take statins now. The new guidelines more than double the potential number of statin takers to 56 million people. Experts say the change in statin use could potentially prevent nearly 500,000 heart attacks, strokes, and cardiovascular deaths over a decade. Certainly some staggering numbers there, but do the benefits outweigh the risks? ACTIA's Dr. Gilbert Ross says yes.
The new guidelines pay more attention to the totality of the risk profile of a patient rather than just focusing on the LDL. And using a new risk calculating tool, the new guidelines advocate putting people on statins to lower their cholesterol levels, especially their LDL levels, if their 10-year risk of a cardiovascular event comes out to be 7.5% or higher, which is far looser standards for putting people on cholesterol. It's going to increase the fraction of adults between the ages of 60 and 75 who are recommended to be on cholesterol-lowering medications, specifically statins. And the cost will be a significant factor, although statin drugs now are all generic except for, I think, Crestor, which is still on patent. But the large majority of statins, cholesterol-lowering drugs, are now generic, and they're really quite cheap. But still, when you're talking about millions of people taking these drugs over the course of a lifetime, be it 10 years or 40 years, you're talking about billions of dollars. So it's not a small deal, it's a big deal. Thankfully, the statin drugs as a class are among the safest drugs in the pharmacopoeia. That doesn't mean they're completely safe for everybody. There's a very small risk of a serious muscular abnormality called rhabdomyolysis, in which the muscles basically dissolve, leaking enzymes into the blood that cause kidney shutdown. That happens well under 1 in 10,000 times. It's really not a serious risk. So statins have actually been vastly underused in the American population before. And if these new guidelines convince more doctors to put patients on statins and more patients to take them, this might turn out to be a very good thing.
And to read this story and others, you can head to our website, actia.org. That's acsh.org. While you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For ACTIA, I'm Anna Samovska.